conclusion, with regard to shelters, antibody testing provides a very important tool for the management of disease outbreaks, as we've already discussed. But that's really important, and we're really excited about how well we can manage some of these outbreaks. Outbreak of distemper that we just managed, it didn't take very long to really stop that distemper outbreak. Once we got in there, tested the animals, it was going on for a bit of time before we got in and got the samples. Once we got the samples, it really did end pretty quickly, probably faster than any other that we had done. So it is possible really to use testing. And it was pretty much these rapid on-site tests that we were using, because we have to have a quick answer, and they'll give you an answer in 20 minutes. We can't do the gold standards. That's why we have quality assured the on-site or the rapid test against the gold standards. With regard to companion animals, antibody testing does provide an important tool to determine if an animal has developed or has maintained immunity after vaccination or revaccination. It's also an excellent indication of if and when revaccination is needed, if you want to use it in that way. And I know some people would rather revaccinate, whereas others, if the animal's already immune, would rather do titers. And one of the things that I try to tell everyone is if a vaccine is not needed, you really shouldn't be using it. It's a very powerful biologic, and it does have the potential to cause adverse reactions. And so I think when we do a risk-benefit analysis, everyone will agree that if the animal needs the vaccine, like a distemper, a parvo, an adeno, the core vaccines, they should be getting those vaccines. But if it doesn't need the revaccination, that particular revaccination has the potential to cause an adverse reaction. I have never seen an adverse reaction from taking a blood sample and doing a titer. I've seen plenty of adverse reactions from vaccinating when it wasn't necessary. Again, this is my passion. It's what I feel, and not everyone agrees with me. And part of it is cost, too. And I must say that the cost of these on-site tests are becoming more reasonable, but you can buy a vaccine more cheaply than you can have a titer test done. There's no question about that. So antibody testing can be performed reliably on-site or in a laboratory in the veterinarian's office, and that's what I was hoping to see. And this VaxiCheck really does allow that. It takes about 20 minutes, and if the puppy has had its last vaccination and it's in 2 or 3 weeks later, and you do a titer test, and if it's not positive for distemper, then revaccinate immediately. Don't wait till a year. But again, there are always cost considerations, and there has to be, so I understand that. So thank you very much, and I hope that you enjoyed our presentation. And thanks very much to Maddie.
Okay, we have some time for a few questions. I'm not 100% sure if you can see the slide up right now. I'm going to go ahead and read the question, so if you guys are still listening, I'll go ahead and read the question, and Dr. Schultz will go ahead and answer the question. This is a comment, actually. The cost of titer testing may be prohibitive for shelters. Do you want to comment on that, Dr. Schultz?
Well, one of the things that Maddie's Foundation, by supporting our laboratory, has done is they've basically allowed us to do some of this testing for shelters, especially with outbreaks, and we can provide it at a no cost or a reasonable cost for shelters that are having outbreaks. So that's one of the possible options. If you're able to do the on-site test in your shelter, you're looking at about $7, $8 per test. So that may become cost prohibitive. But if you think about how much it really ends up costing you with euthanasia and death losses and so forth, you'll have to figure out whether or not it's worth that amount. But yes, as I indicated already, cost is always an issue.
Okay. The next question is, hold on a minute. You mentioned titer testing for adult animals in the face of an outbreak. What about testing puppies and kittens?
Yes, for sure. That's critically important, and you'll want to know whether they have any passive antibody. If they're young, they may still have enough passive antibody to provide some protection. The one thing that we can't do is when we're doing titer tests, we cannot distinguish between passive antibody and active antibody. But you know if the animal is under 14 to 16 weeks of age and it has protective levels of antibody, there's a good chance that that's passive antibody. Now keep in mind that if that animal stays in that environment, and depending on the amount of virus it's challenged with, passive antibody can be overcome by infection, whereas active antibody cannot. So the puppies and kittens are always a special problem for us.
Okay, we're going to answer a couple more questions here. This question is, see if it came through. In antibody shelter testing, can a batch test be done to help with costs? An example would be a queen and her kittens.
It is possible to pool the samples, and what I would say is do the queen and you can pool the kittens, because the kittens are likely to have a similar titer if they all had an opportunity to suckle. So I would pool them that way. I'd pool the queen and then I'd pool the kittens. So yes, you can do that.
Okay.
And keep in mind that you don't have to look at a certain level. It just has to be positive or negative in these on-site tests. So we're not looking for a particular number. We're looking yes or no, positive or negative.
Okay, the next question is, does antibody titer for rabies immunity play any role in checking a cat admitted to a shelter with a questionable bite injury with no known vaccination history?
Again, because of the legal implications, that information is very valuable, but they still will treat the animal as a non-vaccinated animal, even with a titer. So, unfortunately, rabies has little or nothing to do with immunology or immunologic tests. It has everything to do with state and local municipal laws. And we're hoping that we can get some changes made to that. I don't know why we shouldn't have a national standard for rabies instead of state standards. But even within states, cities or counties can have their own rules and regulations. They can't be any more lenient than the state rules. And by the way, every state now in the United States is a 3-year rabies state. And everybody should be using 3-year vaccines after revaccination at a year. So when you vaccinate at 12 weeks of age and not earlier than that, you revaccinate at a year of age or within a year, you really should be using a 3-year product. And every state now accepts that. And if there are any municipalities, cities within your states that don't, those laws should be changed.
Okay. This one. Hold on a minute. What are some of the protective titer numbers for diseases? What are some?
That's a really good question, and it's not so much the numbers. There's information in the literature that suggests with a hemagglutination inhibition test for parvo, you must have a titer of 80 or greater. That's not true. In challenge studies with many vaccinated animals, as long as I go from a negative to a positive, which in the hemagglutination test is you're either less than 20 or you're 20. So less than 20 is negative, 20 is positive. When I challenge those animals at 20, they're just as protected as the ones that have titers of 10,240. So these numbers that we have assigned to titers are no longer applicable because there are many different ways of measuring it and the numbers no longer apply. For example, in the old days when we did egg inoculation testing to measure antibodies to distemper, you had to have a titer of 100 for that to be protective. Then when we switched to tissue culture, virus neutralization, then it had to be 32. Now, with various tests we have, we know that if the test is a neutralization test and it's 4 or greater in tissue culture, the animal has protective immunity. So the numbers are not as critically important as some would like to make you believe, mainly because they don't, unfortunately, have the comparative studies as we do, where we do a lot of challenge studies because we do a lot of vaccine research, and basically with every vaccine that's on the market, we have done a lot of studies with those vaccines.
Okay, here's another question. Approximate cost for the titer check and vaccine check.
If you're just looking at the cost of the test, not your time and so forth, for both of them you're looking at about, and again, the one test is more dependent on numbers of tests being run than the other. The vaccine check, the cost would be the same with 1 or 5 or 12. The titer check, the more you run, cheaper they are because you don't have to set up as many standards. And so you're looking at about $10 to $15 per test. You can get as low as 7 depending on numbers. So that's a ballpark figure. I hate to give that kind of information because there's so much that goes into and along with that titer testing. For example, if it's a pet dog and they're coming in for their annual exam, it's not just the titer or it's not just the vaccine. I mean, vaccines are inexpensive, but when you put that together with your physical exam and all of the things that need to be done during that annual visit, you're not really looking just at what that titer test costs or what that vaccine costs. It's what the whole exam costs, and I'm not in a position to really determine what that is. I know it varies tremendously from clinic to clinic and area to area.
Well, that's about all the time we have for questions. So I know you guys submitted a lot of questions, and I'm really sorry that we didn't get to them, but hopefully we'll have a chance to take a look at all of them and get Dr. Schultz's answers to some of them and provide some more information to you on our website. Before you go, we have...
Also, one of the things to look at on the website are questions and answers associated with our vaccination guidelines. And there are 60 questions and answers with the World Small Animal Veterinary Association Canine and Feline Guidelines. And the 2011 edition of the AAHA Guidelines has 60 question and answers. So there's a lot of questions and answers there.
Good. That's great. Well, before you go, we have a brief survey. I think it probably already popped up for you. You should see it on your screen. So please take a few minutes to fill that out. We really appreciate your feedback. I want to thank Dr. Schultz and everyone who joined us tonight for being part of Maddie's Institute's first webcast. What an information-packed presentation. We hope you'll come to our website to check out the other resources and events that we'll be presenting, including our Thursday, October 6th webcast with Dr. Brian DeGangi, Clinical Assistant Professor of Shelter Medicine at the University of Florida. He'll be talking about the first 60 minutes, Animal Sheltering's Critical Hour. Again, that's October 6th. Then on November 3rd, Dr. Claudia Baldwin of Iowa State University and Kylie Maddox, Director of Operations for the Nebraska Humane Society, will be joining us for a webcast on learning to use the Maddie's Animal Shelter Infection Control Online Assessment Tool. We hope you checked out the resources and the widgets at the bottom of your screen, but if not, you can find them on the Maddie's Institute website. In a few days, we'll be contacting the winners of our free on-site titer test kits, thanks to BioGal Laboratory and Symbiotics. For those of you who signed up to receive RACE-CE, Maddie's Fund will be sending you your certificate by email within 2 weeks' time. Thanks again, Dr. Schultz, and everyone for attending this evening.
Thank you very much.
Good night.